parasite is an organism that lives in another organism, called the host, and often harms it. It depends on its host for survival. Without a host, a parasite cannot live, grow, and multiply. For this reason, it rarely kills the host, but it can spread diseases, and some of these can be fatal. Parasites, unlike predators, are usually much smaller than their host, and they reproduce at a faster rate. There are three main classes of parasites that can cause disease in humans. They are protozoa, helminths, and ectoparasites. Parasites vary widely. Around 70% are not visible to the human eye, such as the malarial parasite. But some worm parasites can reach over 30 meters in length. Parasites are not a disease, but they can spread diseases. Different parasites have different effects. Did you know? How can a parasite enter your body? Let's take a look. Parasites usually enter the body through the mouth and skin. Parasites that enter through the mouth are swallowed and can remain in the intestine or burrow through the intestinal wall and invade other organs. Often parasites enter the mouth through fecal-oral transmission. Some parasites can enter directly through the skin. Others are transmitted by insect bites. Rarely, parasites are spread through blood transfusions, in transplanted organs, through injections with an needle previously used by an infected person, or from a pregnant woman to her fetus. Some other infectious organisms, such as certain viruses and bacteria, they also are transmitted by these same methods. Fecal-oral transmission of parasites. Fecal-oral transmission is a common way to acquire a parasite. Fecal refers to feces or stool, and oral refers to the mouth, including things taken into the mouth. Infection that is spread through the fecal-oral route is acquired when a person somehow ingests something that is contaminated by feces from an infected person or animal, such as a dog or cat. Many parasites invade or live in people's digestive tract. Thus, parasites or their eggs are often present in people's feces. Infected people often spread their infection when they do not wash their hands adequately after using the toilet. Because their hands are contaminated, anything they touch afterward may be contaminated with parasites. If people with contaminated hands touch food in restaurants, grocery stores, or homes, the food may become contaminated. Then, anyone who eats that food may get an infection. Ingestion does not have to involve food. For example, if a person with contaminated hands touches an object, such as a restroom door, the door can become contaminated. Other people who touch the contaminated door and then touch their fingers to their mouth can be infected through the fecal-oral route. Other ways infection can be spread through the fecal-oral route include drinking water contaminated with raw sewage, eating raw shellfish that have been cultivated in contaminated water, eating raw fruits or vegetables washed in contaminated water, swimming in pools that have not been adequately disinfected, or in lakes or parts of the ocean that are contaminated with sewage. Skin transmission of parasites. Some parasites live inside the body and enter through the skin. They may bore directly through the skin, be introduced by the bite of an infected insect. Some parasites, such as hookworms, enter through the skin on the soles of the feet when a person walks barefoot on contaminated soil. Others, such as schistosums, which are flukes, enter through the skin when a person swims or bathes in water containing the parasites. Insects that carry and transmit organisms that cause disease are called vectors. Some insect vectors transmit parasites called protozoa and some helminths. Many of these parasites have very complex life cycles. Insects and mites that live on or burrow into the skin are known as ectoparasites. They are transmitted by having close contact with an infected person or their belongings. Diagnosis of parasitic infections. Laboratory analysis of samples of blood, stool, urine, skin, or sputum. Doctors suspect a parasitic infection in people who have typical symptoms and who live in or have traveled to an area where sanitation is poor or where such an infection is known to occur. Laboratory analysis of specimens, including special tests to identify proteins released by the parasite or genetic material from the parasite, may be needed. Samples of blood, stool, urine, skin, or sputum may be used, depending on which parasite doctors are looking for. Doctors may test blood samples for antibodies to the parasite. Antibodies are proteins produced by the immune system to help defend the body against a particular attack, including that parasites. Doctors may also take a sample of tissue that may contain the parasite. For example, a biopsy may be done to obtain a sample of intestinal or other infected tissue. A sample of skin may be snipped. Several samples and repeated examinations may be necessary to find the parasite. Let's take a look at some of the symptoms by which you can understand that parasites live in your body. Some common symptoms are abdominal pain, diarrhea, nausea or vomiting, gas and bloating, fatigue, unexplained weight loss, abdominal pain or tenderness. A person with intestinal worms may also experience dysentery. Dysentery is when an intestinal infection causes diarrhea with blood and mucus in the stool. Intestinal worms can also cause a rash or itching around the rectum or vulva. In some cases, you will pass a worm in your stool during a bowel movement. Some people may have intestinal worms for years without experiencing any symptoms. Once you know what type of parasite infection you have, you can choose how to treat it. Some parasitic infections disappear on their own, especially if your immune system is healthy and you eat a balanced diet. For parasites that don't go away on their own, your doctor will generally prescribe oral medication. This treatment is generally effective and proven to work. Some individuals choose natural remedies to cleanse their bodies of parasites instead of conventional treatments. Although these remedies are unproven, some natural health practitioners claim that a large percentage of the US population has parasites, and that everyone should do a regular parasite cleanse. Some even say it should be done once a year. There is no research to support this. Nevertheless, many natural health practitioners recommend cleansing human parasite infections with herbal supplements, such as anise, barberry, black walnut, clove oil, curled mint, galled thread, golden seal, grapefruit seed extract, oregano oil, Oregon grape. There are other naturally based, plant-derived medicines that claim to cleanse parasites from various body systems, including the intestines, liver, and other parts of the digestive tract. Your natural health practitioner may also recommend homeopathic treatments to eliminate specific parasites from your body. Your practitioner should choose gentle herbs for your detox. Some herbal detox supplements can have harsh side effects or interact with medications you're already taking. Because of this, be sure to ask your doctor or health practitioner before beginning any supplemental detox program. Some herbal detox programs last 2 weeks on, 2 weeks off. Others can last for up to a month. It's important to consult your practitioner regarding how long you should be taking your antiparasitic supplements. Many herbs and remedies interact with medications. If you are taking any medications, talk to your doctor and pharmacist before beginning. Have you ever had a parasitic infection in your body? Let us know the answer in the comments. Stay tuned by subscribing to get more interesting health-related videos like this.